Hey, LinkedIn, and welcome to Business Unusual, a show where we're talking with you about how the coronavirus is impacting the ways that we all work. I am Caroline Fairchild. I'm coming to you from my home office right now in New York City because I'm working from home, but for the hundreds of thousands of healthcare workers who are on the front lines right now, working from home is simply not an option. This week, we saw nurses come out on LinkedIn in full force, sharing their experiences about what it's really like to be fighting this global pandemic amid supply shortages, amid nursing shortages, amid something that's never been really experienced or tested for the healthcare system right now. I, like you, I'm sure, hearing a lot from talking heads about what this really means for the healthcare system, how they are responding. What we wanted to do on today's show is talk to the healthcare providers directly, talk to nurses, and that is exactly what we are going to do. But for that to happen, we also want to have a conversation with you right now on the stream. What questions do you have for caregivers? What questions do you have for nurses? Maybe you want to know how you can help. Let us know in the stream, and hopefully we'll have a conversation together about that on today's show. First up, though, I wanted to share with you some new hiring data that we got on LinkedIn just today that is showing a 35% increase in healthcare job postings on the platform. No surprise, the top two listings are for registered nurses and doctors to meet the demand that the healthcare system is seeing right now when it comes to needing people on the front lines to care for COVID-19 patients. We have more for you right now in a video package.
There are more people infected than there are providers. In the height of the coronavirus, the medical industry is keeping on a hiring spree, while the rest of the world sees rolling blackouts in hiring. LinkedIn data shows hiring for medical professionals in the United States has skyrocketed since January, the height of the coronavirus pandemic in China. There have been thousands of postings in search of medical professionals across the platform. All help is needed, but the position most in demand is for registered nurses, followed by doctors. Medical assistants, psychologists, and nursing assistants are also in high demand. The cities leading with hiring are those hardest hit. San Francisco, Boston, and New York City are the top three in search of medical professionals. Raleigh, Durham, and Houston are also among the top 10 cities searching for healthcare workers the most. The hope is to beef up the workforce as COVID-19 cases multiply in the coming weeks. It's a problem we've seen across the globe, with government officials taking desperate measures to get help. Italy, Spain, and now the US are calling for retired doctors, nurses, and other medically trained people to come back to the front lines. But where are all these workers going? Let's take a look at New York to answer that. New York has been hardest hit with coronavirus. It has seen the rate of new infections double every 3 days, and it's projected to hit a peak of 140,000 confirmed cases in the next 2 weeks. To combat this, Governor Andrew Cuomo has ordered hospitals to increase available beds by 50 to 100%. The goal is to at least double its capacity for patients from the 53,000 available beds it already has. ICU beds also need to increase from 3,000 beds to 40,000 beds. Field hospitals are being set up too, like in Javits Center, a convention center in Manhattan, which will soon house 1,000 hospital beds. Similar actions are being taken across cities nationwide. Ohio is looking to convert universities into hospitals to meet up with demand. California, which is expected to have about 25 million cases of coronavirus, is asking the military to borrow Navy hospital ships. But getting the beds might be the easy problem to solve. Getting providers looking over those beds is the real challenge. An official from the World Health Organization told CNBC that an estimated 26 million healthcare workers may end up treating COVID-19 patients. And all this demand means pay is increasing. The New York Times found emergency department specialists can make upwards of $4,000 per week and get paid housing. A problem remains. As these masked heroes keep the front lines at bay, they themselves are becoming infected and forced to tag out of the fight. And there is a dire need for medical supplies.
And on LinkedIn, we are seeing tons of nurses really express fear of the unknown, fear of, do I have COVID-19 and not know it? Am I going to infect my patients? Fear of, are my patients going to infect me? And we're seeing lots of concern there, lots of concern in mental health. Later on in the show, we're going to bring on 3 nurses from across the country to really share their experiences about what they are seeing on the front lines. But first, I want to talk to an expert who can really break down what is going on with the healthcare community and what you can do to stop the spread yourself. Dr. Rhonda Meadows is going to join us here from Providence Health. Dr. Meadows, thank you so much for joining us.
Well, thank you for inviting me. I really appreciate the opportunity. I think you hit it straight off by talking about one of our most valuable resources.
Right.
Those are
Yeah.
the nurses and frontline.
Thank you. Yeah. And I'd really like to kind of just hear your perspective, Dr. Meadows. You're in Seattle right now, which is one of the first communities to be hit. What are you seeing right now at your hospital?
So we were the first state in Washington. We had the first patient as well as the first death, and the nursing home tragedy occurred here. But we have actual cases in a lot of our different regions, particularly Oregon and California as well. What we're seeing is that we're able to manage the people that are in the hospitals today that need the care, but we are planning for the surge, for the worst case scenario. And for that, we actually need more people, more frontline folks, and the protection to keep them healthy and well. They are incredibly important to us. When we talk about nurses, and they are absolutely key. Before a pandemic, we were already short nurses, but we have been actively recruiting to try to bring in more. We have brought people out of retirement, and we have asked for volunteers amongst our administrative staff, who may also be licensed and certified nurses, doctors, pharmacists, and respiratory therapists, anyone who would work the front line. We can manage today, but it's tomorrow and next week that we're most concerned about.
And it seems like everyone across the country is really concerned about what tomorrow and next week can bring. We have Governor Cuomo here in New York saying that in 2 weeks, the healthcare system might just be completely overwhelmed. Are there any best practices that you can share from what you're seeing in Seattle and with your own system in terms of both recruiting as well as maintaining best practices in hospital to make sure that providers have what they need supply-wise?
We do a lot of effort to try to make sure that the people who are currently working for us, our caregivers who are really committed and who are, again, the front line, actually have not only the education, training, but the equipment to the best that we are able to provide. So all of the personal protective equipment, the N95 mask, the surgical mask and face shields, all of that is really important to keep them healthy. At the same time, we have to ask the members of our community and our public to do their work, to do their job, and actually helping us reduce the spread or the speed of spread.
Mm-hmm.
And that means hand washing, social distancing, remaining home, teleworking like all of us are doing right here online, and making sure that we are doing that work. The more cases we can avoid by decreasing spread and transmission, the slower the rate of incline and the slower the flow will be into our hospitals, emergency rooms, ICUs, and ambulatory spaces. We really need folks to lean into that and remain committed. It's not comfortable, but it's what we need to do right now.
And of course, we've heard a lot about social distancing right now, shelter in place, washing your hand, these measures that everyone can do right now to help stop the spread. But for those who are on the stream right now and may not understand how that really connects to the nurses on the front lines and supporting them, can you break it down for us how it is really critical that we all take these actions today?
Okay. Each one of us has the ability to transmit and to have the virus. That means each one of us needs to do our very best to actually reduce that transmission and to reduce our own exposure to the illness itself. So that means when we're hand washing, we are literally reducing how much viral load is on our hands or on surfaces that we touch. When we're disinfecting, we're again reducing the potential for viral spread. When we do social distancing, maintaining at least 6 feet between ourselves and others when we do have to be in the room together, we are again reducing the rate of spread of the virus itself. When we work from home and telework, once again, reducing the spread. The more we reduce, the fewer people actually get the virus at any one given time, and we can slow the number of people who become acutely ill. There are folks who are young, relatively healthy, who have mild symptoms or no symptoms at all, and may not even realize that they are transmitter of the virus. So the whole idea is for all of us to do this, and all of us to do it every day and consistently. When I see people out and congregating and thinking that they are the exception to the rule, they are not. The virus does not discriminate or give up anyone a free pass. So if you are actually out and doing these things and not leaning in with us, then you're basically increasing the number of people who get exposed, who come in and need care, and that actually is what leads to the overload in our system. That means that the nurses, doctors, pharmacists, and therapists who are having to provide care are having to deal with a large volume of people, but limited personal protective equipment, masks, beds, ICUs, vents. And so we need to slow it down, and we need your help to do it.
You mentioned the limited equipment there, Dr. Meadows, and I wanted to get to that. I've seen a lot of stories in the news, a lot of misinformation sometimes too about what's really happening on the ground and what efforts are at bay right now. What are you seeing right now in your system in terms of the mask shortage? And is there anything that consumers can do right now to help with that?
The number one thing for consumers to do is to make sure that they're not out and about, again, increasing the spread. The mask shortage is very real. This is not fiction. This is actually the reality. The N95 respiratory masks that we actually use for people who we know or we're convinced have the illness are used to protect not only the patient and the patients near them, but also the healthcare frontline workers who are taking care of them, the doctors, nurses, therapists, even the people who are sanitizing these rooms need to be protected. We have also the masks that are more surgical masks, the blue ones that you can see on TV that come with a face mask that's clear shield that slows the spread from sneezing and coughing. Those are actually the ones that you are hearing about being created by non-traditional manufacturers because we are that short in supply. We started our own 100 million mask campaign because we didn't have enough to take care of all of our frontline workers, and that is critically important to us.
I'm seeing some questions in the stream about using high-dose IVC in our hospitals. Is that something that is happening in Providence right now?
I don't know that. I'm sorry.
Yeah. All right. Some questions also have some comments here from Nick asking nurses and saying nurses and doctors are working well. Rashina says my organization is making masks with filter inserts and donating them. Are the donation mask efforts that we're seeing, I've seen a lot of those kind of posts in my Nextdoor feed as well as on LinkedIn. Is that welcomed right now from the hospital systems?
Oh, it's very much so. We've had actual campaigns in every one of our markets and every one in our communities asking people to donate the N95 masks that they may have stockpiled or maybe they're hoarding because they're concerned, and we understand that. We've asked non-traditional folks to come in and donate their supplies as well. That includes pharmacists, dentists, veterinarians, anybody who might have a supply. And we, of course, have done what everybody else has done and gotten construction masks as well, because they come closer, at least to providing some protection for our workforce.
And we've talked a lot right now in this conversation about what the general public can do to protect nurses, but this is really a mental health problem for the nurses who are on the front lines, who are facing this every single day. What is your system doing to support them, and how can we kind of think about that from that angle?
We have mental health and behavioral health support services for everybody, including and especially the front line. And that means that we not only are checking on each other through a buddy system, but we're also providing them with online as well as telephonic and then peer-to-peer counseling amongst themselves. We are providing them with as much information as fast as we can to make sure that they stay informed. The best way to address fear is to cancel that with some knowledge and some action on that they can actually see and appreciate. We are also doing the mental health services and support mechanisms for non-clinical people as well, because they are actually still also in the mix. When we started doing teleworking for the non-clinical teams, that led to some folks feeling like they were isolated, that they were separated. And we needed that sense of community because they are actually doing the back office support for our clinicians, including and especially our nurses.
Well, Dr. Meadows, I know I speak for many people on the stream right now when I say thank you so much for the work that you are doing. We'll take this one day at a time. Thank you so much for your insights.
Thank you for the opportunity.
That was Dr. Rhonda Meadows from Providence Health in Seattle, telling us what you can do right now, sheltering in place, social distancing. These may seem like buzzwords that you're seeing on your TV right now, but it's critical that we all do these things to stop the spread and really support our healthcare system during this time. Speaking of supporting our healthcare system, I wanted to talk with nurses on the ground on today's show. So I looked through LinkedIn and found some nurses who are speaking out about what these experiences are like, and I'm going to bring them on the show right now. We have Katie joining us, Taylor, as well as Rosemary. These are nurses from across the country. Katie is joining us from San Diego. We have Taylor coming to us from the suburbs of Chicago, and Rosemary is right here with us in New York City. Hi, guys. Thanks so much for coming on the show.
Hi, thanks for having us.
All right, Rosemary, I want to start with you. You're in New York City like me right now. We have Governor Cuomo saying that in 2 weeks, the healthcare system could be overwhelmed. Does it feel like it is already overwhelmed from your experiences? I know that you had a shift as early as Monday.
Yeah, so definitely the system has been overwhelmed from the beginning when you was getting a lot of patients who were not exposed to COVID, because you have your patients that are actually really sick with other conditions, and those worried well coming in for COVID, and those who are really sick coming in for COVID. And there was a lot of efforts that had to be made on the spot, really, to how to streamline where patients go and keep them safe and not cross-contaminate each other.
Mm. And, I know, Katie, you're in Southern California right now where there is a shortage of masks, and that's led to some policy changes. What are you kind of seeing in your system right now?
We are daily getting updates on how our process is changing. There are changes in what they're expecting us to wear every day. I mean, we're just being bombarded with information, and it's actually really difficult to keep up with just that information. And it also is contradictory to the information that we have been learning since we were nurses. Since we first became nurses, we're being told to protect ourselves at all times, and then those standards are being changed, and it's scary. It's a scary time. We don't know what to expect.
I know I saw those shares, Katie, that we just saw on LinkedIn where you're expressing kind of some anxiety and some fear right now. I think a lot of us on the stream are probably experiencing that right now. Can you talk a little bit about kind of how you're getting up every day and what you're seeing and kind of your mental health right now?
I have put my mental health front and center. I have decided that every day I need to talk to myself when I get up and go to work and decide where my boundary is. I signed up to be a nurse. It's my duty. I signed up to take care of people, but I didn't sign up to do it without the proper protection. Mm-hmm. And for me, as much as I want to be a hero, as much as I want to help as many people as I can, I also have to be a hero to my 9-year-old who lost his father at 6 years old. I can't not be here. Mm-hmm. And so I'm having to prepare myself to make those decisions at some point and say what is too much and when I'm going to walk away if I'm not provided what I feel like I deserve as a nurse.
Right. I think that that's something that probably all the nurses on the stream are feeling right now. Taylor, I want to bring you in. Your hospital in the suburbs of Chicago was one of the first to do these drive-up testing. Talk to us about what that was like to put those in place in real time and the experiences that you're having.
Yeah, we started it because we had our first positive case, and one of my coworkers actually kind of had symptoms. So they said, let's get her tested, but how can we do this without bringing her into the hospital? We don't want to expose her to other people or, bring any possible COVID patients in if we don't have to. So we decided, let's just have you pull up into the ambulance bay. We'll go out there with our PPE on, we'll swab you, and, you just leave from there, and then you're contacted with your results. So it was I went out there to test her, and about 40 minutes later, my manager called me and she said, all right, Taylor, another nurse is coming to get tested. You're going to do it again. And then it literally just snowballed from there. So it is great because we're keeping these stable patients out of our hospital and not, exposing them to anyone else. But at the same time, it was on the news that we did this. And then there's just been a huge, I would say, lack of education to providers that they're just sending patients to our ER now, assuming that we will just test them. And that's not how it works. And it's frustrating because then people are upset with us that we're telling them that we can't test them. We have to get approval through the Department of Health. And so as great as it has been to swab these patients that do have approval, it's also been a huge burden because now we're getting bombarded with calls to our ER. Well, I want to get tested and I have these symptoms and why won't you test me? So it's been great, but it's also, brought a whole nother set of challenges with it.
And those challenges, Rosemary, are you seeing those in New York as well in terms of what you're seeing on the ground and people bombarding the system, not really with the best information about how to get care?
Yes, absolutely, absolutely. I very much resonate with that because the system, the hospital census has really been overwhelmed with people coming in scared and out of fear and out of like lack of information on what you know how to proceed with COVID testing, or like should they be admitted, should they stay in the hospital and wait for the results, should like are we going to test them for mild symptoms or just because they might have been exposed. And like yes, there's also that growing change in policies and procedures on we are the highest risk, and who gets admitted or not. Like the triaging has changed.
Mhm. Well, I know I see a lot of people on the stream right now who are so thankful that you are here with us right now having this conversation. I see comments from Petra saying very much appreciate what the nurses and first responders are doing and going through. Keep up the good work. Rita says, although I'm not in a major big place, I am a frontline worker. It's really scary. And a lot of people do take it seriously. I have been in the healthcare field a whole lot to know that this has been the far worst that I've seen. Katie, in terms of this being the far worst that we've seen, I know that your healthcare system hasn't had any confirmed COVID patients yet, but we're seeing a ton of nurses on LinkedIn expressing anxiety about kind of what's to come, and fearing that the worst is yet to come. We have Kathy Hath here, who's an emergency room nurse, saying, I know the worst is yet to come in Chicago. Do you feel similarly in terms of what's going on in San Diego?
Oh, yeah. We have actually had confirmed COVID cases at our hospital, and a lot of people under investigation. I myself have had some of those people. And there is an anxiety of what's to come because you don't know. It has changed fairly rapidly. And we've also emptied out our floors, our census and elective procedures in preparation for these people coming. And there's a sort of a calm and eeriness that's around. And there's not a ton of conversation about the anxiety. Mm-hmm. It's about the policies and the procedures, but it's not what you're supposed to be. What do you do with those emotions that you're having? You know, all those questions. And our management has been very good at being open to having those conversations, but at the same time, where it's unprecedented, and to expect them to know exactly what to do for us is also, I feel, unrealistic. But I think the more we talk about it and the more we express our fears, the more we can be there for each other and get through it. Transparency is really important in this, allowing people to make their own decisions. Mm-hmm. So I think that there is always an underlying sense of anxiety from everybody. You can just feel it, mm-hmm. And we are seeing patients come in, and there's confusion.
Right. You can definitely feel it. And Katie, I really appreciate you being so candid here on the stream. And let's be here for each other. I know that there are a lot of people on the stream right now who may not be working on the front lines, but do feel their own sense of anxiety. And they also want to support you. I feel like a lot of the media conversations right now are about what nurses are doing, the shortage of masks, but this anxiety, this mental health aspect of it, I think is really critical to shine a light on. Katie, if you're open, I'd love to kind of hear what you're experiencing right now. I know that you had a bad day yesterday. Is there anything that you can share with us in terms of how you're getting through?
You talking to
me?
Oh, yeah, Taylor. Sorry. Taylor. Katie, sorry.
Yeah, I mean, yesterday I was kind of at my breaking point, and then I got home I was at work yesterday, and we have our whole respiratory unit that we are strictly just putting patients there that we have concern for COVID. And it's getting to the point where, again, with like the communication and education, we were all of a sudden getting tons of nursing home patients just sent there because there was one positive case and they were concerned. So I understand everyone's fear because I have the same fear. My management has the same fear, but at the same time, like in the hospital sense, we can't bombard hospitals. And unfortunately for me, or fortunately, I mean, I work in a hospital, I work in the emergency department. So these patients are going to be coming here. But, you know, it's to the point where for me, just talking about it, even with my colleagues, the things that are changing every day and the masks that we get one per shift and you keep it in a bag, you know, we just have to talk to each other about it because it just sounds so like asinine and crazy that we're using the same mask all day long that we just talk about it. You know, we talk to the doctors, we talk to each other. You know, every day when I leave work, I call my mom and I call my best friend and I talk to them and tell them about my day. And whether they understand it or not, because they're not necessarily there on the front line, like just them listening and letting me vent helps just so much for me.
Well, Taylor, you have a lot of people listening in on the stream right now. Tasha says, thank you for everything you do for us. Joshua says, thank you for your sacrifices. We love you. Maria says, thank you for all your efforts. Gabrielle says, nurses inspire me. There are countless more I could read. And I speak for them when I say thank you as well. Rosemary, I know that, you know, what's going on in New York right now, we're kind of reaching the height of it soon. What are you seeing right now in terms of the policies and procedures that you have to have in place, and kind of how are you feeling in terms of, is your hospital really setting you up to succeed?
So, you know, as the situation changes, we change on the run as well. That's what crisis management is for. And I think that everyone is working tirelessly to make sure the best practices are in place. You know, unfortunately, we're dealing with a situation that we don't understand in its entirety because it's a, you know, it's a novel virus. And as patients come in, we try to really triage if they're having, you know, symptoms that will progress as COVID patients, and try to put them in areas. We had to change operations several times where we had to divide up the emergency department to be COVID versus non-COVID, and where, you know, and the policies with the PPE has to change, right? Like we went from wearing a mask when you feel ill to wearing a droplet mask all the time, to wearing an N95 all the time, to having PPE for this medication. And like I definitely see the stress it has on the staff as well, because we're not just, we are also family members. We have kids. We have, you know, we're daughters, mothers, wives, brothers, sisters, you know, and we have to take the risk of going home and possibly, you know, being carriers, right? Because I think, you know, healthcare workers on the front line are the highest at risk because we see the most severe cases.
I'm so glad that you brought that up in terms of the tension that a lot of nurses are feeling right now of whether they should continue to go to work, or is even, sorry, I think we have a little bit of a connection issue here. But I wanted to kind of ask, you know, that tension that nurses are feeling right now in terms of needing to go to work to protect patients and do what they want to do, but also having people at home that they have to care for. Katie or Taylor, have any nurses in your hospitals made the difficult decision to stop care at this point?
Go ahead, Terrell.
We haven't had anyone like stop and say that they don't want to come in. We do have several girls who are pregnant. So, you know, for them, we're just keeping them away from it. They're always going to be in the non-COVID area. They're never going to be doing the testing. And even one of my other coworkers he's been gone on paternity leave, and he extended it even longer because he didn't want to come back and then have a newborn at home that he's then potentially exposing it to. So everyone in our department has been really great with, you know, yeah, we have pregnant people, we have people that we're concerned about that we don't want to expose to this. So some of us are having to take more of the, I guess, stressful parts of the emergency department, because at the same time, like this is my family too. These are my coworkers, this is my family, we're a team. And I know that if I was pregnant, I would want them to be protecting me as well. So that's what we're trying to do. Because no one wants to leave, everybody wants to help. And even right now, we have like 5 nurses who have cold symptoms that we had to test to make sure that they don't have it before they come back. So now it's even more so picking up extra hours because these hours are open. So it's just really a team effort.
Exactly. Katie, anything you wanted to add there?
Yes, I have. I do know people who have decided that they're going to use all their vacation time or sick time because they're concerned and they don't feel like they're being given the proper protections. It's something I've had to discuss with my significant other. We have 3 boys together, and it's, when do I stop coming home? At what point is that? Is that now? Is that, when do we make that decision? And where do I go? So there's a number of different factors, that are involved, and I don't blame the nurses that don't want to be there. I think we need to be open to all of that being okay, because we're all humans. That's what Rosemary said. We are all human beings.
Mm-hmm.
We're not just nurses.
We are all humans, and we're trying to get through this together. I'm seeing some comments in the stream. One from Karen, who said, Katie said something that really resonated with me, as my daughter works for a hospital in Oregon, whom she felt was not provided PPE for the nursing staff. She had a panic attack and was told to go home. She's been home for a week and now feels like she is going to get fired. She worked very hard for her nursing degree with 3 young children by her side and loves being a nurse and loves her hospital family. Are the hospitals doing enough to support nurses right now? This is such unprecedented times, and of course we have to be caring for patients, but how are you all feeling in terms of the support that's being provided for nurses?
I mean, personally, my manager has always been like in the forefront with us and dealing with it. And it's no different with everything that's going on now. Part of our organization has tried to say, oh, have them wear these masks. And, when your shift is over, you'll give it to the next nurse. And she was very adamant at saying, no, I'm not doing that. They're not going to be sharing face masks and just wiping them down. At some point you have to say no. So, she understands what's going on, and she's fearful for us just as we're all fearful. And, if she could be out there making N95s so that we could have a new one every time, she would be doing it. Mm-hmm. So I definitely think that, at least for my personal experience, my management in all aspects is doing everything that they can. Obviously we have this shortage of masks going on, so we're trying to think of creative ways to not contaminate these masks and be able to reuse them, even though that's not necessarily how they're supposed to be used. They're doing everything that they can to try to figure out how to make this the safest possible for us.
Mm-hmm. I'm hearing some questions on the stream, in terms of one from Michael, who's saying, what can we do to help you? Nurses are on the front line of healthcare. Don't tell anyone differently. So for those who are on the stream right now, I see hundreds of them resonating with your stories, wanting to support you. What is your message to them?
I would just say, be patient with us. We've had some people come in, and like I said, we can't test everybody, and they're super frustrated, but, understanding that I'm just as frustrated as you are. I want to be able to test you. I want to be able to give you a diagnosis. I want you to know what is going on, and we're there for you, but understanding too that we're also exposing ourselves on a daily basis to this, because we're nurses and this is what we do, and we want to take care of you. So, I guess not being so upset with us, because we're trying as much as we can to help you guys, and at the same time risking our own health.
We're all humans. I feel like no matter, we've talked to CEOs, we've talked to people in different industries on this show, and one of the things that we are all grappling with is that these are unprecedented times and we don't have all of the answers. Rosemary, is there anything you want to add in terms of the people who are on the stream right now and want to know what they can do to help you during this time?
Yes, absolutely. Every day I go into work, I think that my chances of having COVID are higher. It's a hard decision to make, to always go to the front line. I do feel like I have a duty as a nurse. Even my own child asked me, Mommy, do you really think you should be a nurse right now? And my gut was like, of course, I have to be. But I definitely get it. It's such a dilemma. It is a great dilemma. And for people, I just want to tell people that, please, take it seriously. stay isolated as much as you can. If you're really, really sick, come to the hospital. But if you're not so sick, think about other ways that you can seek medical help, whether it's telehealth options or not. I want to just say thank you to organizations like the American Nursing Association, who's been like lobbying and advocating for PPE to the front lines. Groups like SONCL, who are collecting PPE, those who are making PPE masks and stuff like that and sending them out to everybody. I appreciate that. And I just want to also mention greencompassglobal.com. They are creating hand sanitizers. They're organic farmers who specialize in hemp for holistic wellness. And they are creating hand sanitizers that's never been part of their line to match donations. So if you buy a hand sanitizer, they will match a donation and send it to hospitals in need. So I really do appreciate everybody's efforts out there. Everyone is doing their part, all the support. And please call people, call and reach out to loved ones, people you haven't even called for years. I don't care if it's someone from high school that you graduated high school and haven't spoke 2 years. Just call and check up on them. Give them tips on how to increase their immunity. That's the best we can. That's the best we can do.
Great perspective, Rosemary. I really appreciate it. And I see a comment here from Bill who's saying, I'm thinking of doing a virtual support group for nurses for free. I'm licensed in Texas as a psychotherapist. So there are people out there who are willing to help. And, Katie, Taylor, and Rosemary didn't know each other before today, but I hope that, now that you guys know each other, you have this support system. There are tons of people on LinkedIn who want to support you as well. I speak for all of them when I say thank you so much for sharing your stories, for doing the work that you are doing and coming on today's show.
Thanks for having us and for, bringing light to the other end of what's going on.
Take care. I hope to connect with you guys on LinkedIn and see you soon.
Thank you.
Thank you. Wow, that was really powerful and a completely different line to this whole epidemic that I've been watching on broadcast television and other networks. And I really want to thank everyone for coming on the show today and sharing their stories. We are all figuring this out together. If you're on the stream right now and you have questions or comments, we really want this to be a place where as a community we can come together and hopefully give you the answers, the insights, or even just the community that you need right now to stay connected. I'm Caroline Fairchild. This is Business Unusual. Thank you so much for joining us.